All right. Welcome to All Things Odd. I'm Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
All right. So let's get that going there. So we are excited to have this episode because it's things that we don't like to talk about, but we still do. And so we came up with this topic and have some really interesting things that we even found out about as we were looking this up. So hopefully you guys will enjoy this, as well as if you are joining, please comment along if you have any questions about what we're talking about, or if there are other things you don't want to ask or you don't want to talk about regarding ears. And so it's kind of funny. I'm just kind of sharing it off to some of our other groups here so we can get people in here. But so we're going to talk about things we don't necessarily like to talk about. And I'm going to have Dr. Galloway start with our first topic. So the one thing that we want to talk about today that we don't always talk about is batteries. So I'm going to let her take it away.
Yep. So it's funny because we always tell patients, like, don't swallow the batteries. And most of our patients are adults. So it's kind of just like, that's obvious that you're not supposed to. But it happens. And a lot of times it happens to small children. And it's more dangerous than even I thought that it was, because you don't hear about it as much. And so I kind of did a dive into the research. But I saw something recently, and I believe it was on Facebook, and it was something about a button battery. A button battery is like what we use for hearing aids, getting lodged in a child's esophagus and getting sort of pinned against the esophageal wall. And what the person was saying was that it happened because the positive side of the battery was running against their negative blood type. And I was trying to figure out if that was actually true, that could actually happen. So I don't know that it has anything to do with blood type, but if you do know anything about that, please chime in because I would be interested. But essentially, that battery can get adhered to the esophageal wall and it can perforate it or start to burn it. And then it kind of does get stuck there. And so I don't know if that would be like worse with different blood types. I did read that if it's the negative side of the battery, so not the side with the little positive, is against the esophageal wall, it's more dangerous and it can cause more damage. And so essentially what can happen is if a battery gets trapped in your digestive tract, so past the esophagus, the mucosa is going to bridge the positive and negative terminal of the battery and complete the circuit. So it can actually allow electricity to flow inside of you because you swallowed the battery. And so that electrical flow, it creates hydroxide radicals that rises the pH of the tissue, leading to caustic injury and coagulative necrosis. So it essentially eats that tissue, right? And they've documented coagulative necrosis within 15 minutes of contact. So if you know a small child that has swallowed a battery, like the quicker that you can get them somewhere, the better. The study I was looking at was called Button Battery Ingestion in Children, and the lead author was Christina Linguan. She's a doctor of osteopathic medicine, and it was done in 2016. So they were looking at different case studies of small children that had swallowed batteries. Unfortunately, the rate of fatality on this was like 23% of their case studies. So 23% of the kids actually died because of ingesting batteries. Lithium batteries are the most dangerous. So most hearing aids, all hearing aids take zinc air batteries. So lithium batteries are the most dangerous because they pack the most power. It's usually 3 volts compared to the 1.5 volt of an alkaline battery. And then I tried to look up alkaline versus zinc air. Zinc air is like the least dangerous because of how the power is distributed, but still, it could obviously be a bad thing. And so we saw a big rate increase of issues related to swallowing batteries in the 90s whenever they started making lithium 3-volt batteries in small sizes. So a hearing aid battery is 12 millimeters. The 90% of the most severe outcomes were due to greater than a 20 millimeter and a lithium cell. So anyway, it's never good to swallow a battery, but I did not know, just how bad it could be. And so I thought that was really interesting. They had all these different case studies of kids that had swallowed different sizes of batteries. Some of them they knew it was an hour ago. One of the kids, it was self-report that they swallowed it. The parent didn't see it. And so anyway, just not something to mess around with. If you think that's even a possibility, take the kid in, because they'll do imaging to track it and see where it is, and then possibly like endoscopy to remove it. You'll see this button battery hotline at the bottom of the screen. That is the hotline to call. But if it is a pediatric, I would just go to the ER, because you're not going to get it out any other way. And so you don't know how dangerous it could be. I also read that if the power has been depleted from the battery, so like it's a used battery, it's less dangerous than if it was a new battery. So either way, not a good
That's
thing.
good to know.
We tell our patients don't swallow the batteries, but until about 5 years ago, pediatric hearing aids didn't have a rechargeable option. And so parents used those batteries with their kids, and then we put a little lock on the battery door, the tamper-resistant battery door, so that a kid couldn't open it and eat it. But, kids over at grandma and grandpa's house, whatever, batteries laying around, they have little and they have fun stickers on them. And so I could see how a kid would think that, was a good idea to eat, even though it isn't. So that's the number one thing that we don't talk about, but we should talk about is don't eat the batteries. And if you think that your pet or a child or anybody has swallowed a battery, call that battery hotline or take them straight to the emergency room or the emergency vet, because for pets, it's going to be the same deal.
Yeah. And if you're watching too, and you're an audiologist, and there's a way that you talk about it with your patients as well, put it in the comments so that people can see. We are going live on Facebook, YouTube, and on LinkedIn right now. But yeah, like I usually tell my patients, make sure that you're not like having a basketball contest and like tossing those batteries into the trash can and seeing if you're getting it in, but literally make sure that you get it into the trash can for pets and young children. But yeah, I had no idea about the necrotic tissue, and that's really kind of interesting. So please spend the time to talk about your patients about how important it is. I'm glad that there's a lot more rechargeable batteries out there, which are lithium, which would mean they'd have to I guess ingest the whole entire hearing aid.
Well, you can pry those cells out of there, and I guess then it would be more dangerous than a zinc air because it's lithium, right? But it's hard to get those out. Like you have to have a special tool to remove it. It's not something that probably a small child would even be able to do.
Right.
Still pretty crazy.
Yeah. Well, awesome. Good job just finding some great information here. Okay. The next topic that we don't like to talk about, but we still talk about is safe and also non-safe ways to clean your ears. And so again, audiologists, if you're watching, put in the comments maybe some of the ways that you have either heard people clean their ears or that you've talked about with patients to kind of help everybody along here. But what's interesting is let's back up before we get to cleaning the ears, just maybe the consistency of earwax. And I'll let Dr. Galloway talk about that first.
Yes. So I always tell patients that earwax is a combination of dead skin cells sloughing off, oil, and sweat. So you have sweat glands in your ears, you have oil glands in your ears, all of that mixes together to create what we call earwax. The texture of it can be different based on a lot of different factors. And actually in grad school, one of my professors had us read like a 20-page article on earwax. And it talked about how different nationalities have different textures of earwax. So Caucasian people usually have like sticky, wet earwax. I know specifically they talked about Asian people having like a flaky, dry earwax. And I mean, I've seen, all different textures just by looking in people's ears, but that was interesting to me. So I think it's more like, what is the ratio? Is there more oil to dead skin or more, dead skin to oil or whatever? But yeah, so it can be different, consistencies just based on like what that combination is, but it's a natural process, right? Like you're supposed to have it. Evolutionarily, the reason we have it is because it smells bad and it's sticky. So bugs can't crawl in your ears and get stuck. I mean, I think they still do in some cases, but that's what earwax is for, to like lubricate your ear, but also to prevent foreign bodies and things like that in there.
Mm-hmm.
So
yeah, and sorry for the people who are Mountain Standard Time with us because we do this show over our lunch break. So yes, this is kind of getting uncomfortable. Some of the things that we're going to be talking about that we don't like to talk about, but we still do. But we thought this would be kind of fun to do. So we apologize. We're sorry, but not sorry, because this is kind of we have we're trying to not put up too many
Yeah.
disgusting looking pictures during the lunch hour.
Yeah, we
But we still
decided
need
to
to talk
forego the
about it.
images on most of these, but
Yes.
yeah, it's normal though. People come in for a
Hmm.
hearing test and they're so embarrassed and like, oh, I tried to clean my ears, but it's like that's all normal. I mean, it's more strange if you didn't have any and your ear would be all dried out. So,
Exactly. Yeah.
you know,
Yeah.
we don't think it's that gross.
Yeah. Okay. So we'll talk about just ways to clean your ears. Okay. So I just wanted to bring this up. No keys. Your car keys are
Mm.
not there to clean your ears out. And don't laugh, but I did have a patient that came in that literally said, "Oh, it's okay. I can totally clean it out while I'm sitting here." And he pulled out his car key and
Oh.
stuck it in his ears. And I was like, "No!" I was like, "Don't do that." I'm like, "Oh my gosh, don't do that." And I go, "Doesn't that hurt?" I'm like, "You're not supposed to do that. Like, it's really sensitive in your ear canal." And that car key is like really dirty, you know? And he's like, "Oh, I do this all the time." I'm like, "Okay, well, you need to quit doing that because it's
Yeah.
not very like clean, and like you could scrape your ear and then you could have an infection." And so no car keys, leave those for the car only. No bobby pins. Now my dad used to clean his ear out with a bobby pin.
A
Like
lot
I
of
couldn't
people say
couldn't
bobby
even
pins, and it's like,
watch.
ew, why do you think
Yeah.
that's an instrument for that?
Yes, no, and you can't even, first of all, you can't even see yourself cleaning your ears. I mean, you don't even know how far to go in. And even Q-tips. Q-tips is also a thing that I know that a lot of people have talked about that they've used for cleaning their ears. Okay, it's better than a key and a bobby pin, but still, okay, there's no depth perception if you're cleaning your own ears out. And what I usually tell people to do is when they get out of a shower, number one, Dr. Galloway, just said that wax is in your ear for a reason, right?
Mhm.
So it's produced at a certain portion of the ear canal and then it migrates out on its own. So until it kind of gets to where it's like sticking on your AirPods or like people can see it, like have somebody kind of let you know, then you can start cleaning out. But the best way to clean it out is to get a Kleenex, roll it up so it's conical in shape when you get out of the shower, hold it in your ear, the cone part, so that way you can absorb the water that's coming out that got stuck in your ear after the shower, and then just kind of twist it around so that way it gets the part of the wax that migrated out to the opening of the ear canal so that you can kind of clean that off there. Okay. So
Mhm.
definitely no keys, no bobby pins, no Q-tips, and then Kleenex. Obviously, I know that a lot of people said don't stick anything that's bigger, smaller than your elbow in your
Mhm.
ear. Kind of, sort of. Yes, that's the truth. All right. And then Dr. Galloway's got another way that we saw that people have cleaned their ears.
Yeah, so I was going to just go back for a second. One of my friends in grad school, she lived with several people in college, and so she was in the bathroom, and she had, well, actually, her roommate was in the bathroom, had a Q-tip in her ear, and somebody came through the door, like multiple people living in a house. Somebody else tried to come into the bathroom, and it knocked it, so she perforated her eardrum. And so it doesn't, my dad told me this when he taught me to drive, it doesn't have to be you that's the idiot. Like, that's, there could be outside factors. The dog barks, something happens, you startle yourself, so that's also a reason why Q-tips aren't a good idea, because it's usually something that was not intended to happen that causes the injury.
Mhm.
So the next thing we're going to talk about is ear candling, and this one's interesting because people swear that it works and that it creates this therapeutic benefit for them and all of this. It doesn't work. And we've got a really awesome quote from our
Oh,
favorite
here, let me see if
audiologist,
I can put
Dr.
that one on.
Doug Beck, here in a little bit. But essentially, just when you think about the laws of gravity, there's reasons why this wouldn't work. So there have been studies. If you take, a test tube and instead of your ear and you ear candle, there's residue of that earwax inside the
Mhm.
test tube. You can also burn your eardrum. All kinds of bad injuries could happen because of that. Like Dr. Phillips was saying, you don't have depth perception. And so it's just not a good idea and it doesn't help. I've had patients come in, and there was this one patient, and I looked in her ear, and she had all of this white stuff in her ear. And at first, I thought it was some sort of drainage from her ear that had dried or some sort of residue from an eardrop. And I asked her, what have you been putting in your ears? Have you been using eardrops? And she said, oh, no, I don't put anything in my ears. I said, okay, well, do you clean your ears? What is this white stuff in your ear? It was candle wax from years of ear candling, and it had all built up in there. And so it was actually, causing a problem because it was like filling up her ear. So it actually can do the opposite of help you.
Yeah, and there's that picture that you're talking about too. This is after 2 ear cannelings, it says. There's that
Mhm.
white powdery substance in the ear canal and the tympanic membrane. If you look up at the top, that is typically what we see when we look in the ear canal, is straight shot to the eardrum. That's that shiny part in the back there. And then
Mhm.
this is after 1 ear canneling session, and then this is after 2 ear canneling sessions. And sometimes
Yep.
there's that powdery residue that stays on the eardrum as well.
Well, and if I looked at that without knowing, that looks like scarring. That third
Mhm,
picture looks like scarring on the drum, like just a little, from a Q-tip or an ear infection or tube or whatever.
mhm.
So a lot of times, if you're asking the patient, like, what are you putting in your ear? Do you have scarring in your ear? A lot of people are not going to just forthcome with the information that they're using ear candles because they've probably heard it's not good.
Mhm.
But especially if you're coming in with hearing issues and you have this stuff going on, it's like that's not helping the situation by any means.
So
So
we are finding okay, so this was done, by we've had Doug Beck on the show here, and when he was editor-in-chief here, he had some, um, uh, I guess, quotes that he was I'm just gonna read this because
some
we
choice
just
words.
literally, like, cracked up and thought it was hilarious because it is so Doug Beck. So somebody, if you're
Mhm.
watching, tag Doug Beck. So this is what he says. He says the claimed benefits of ear candling are based on dangerous, illogical, and incorrect assumptions. Ear candling is, in fact, a dangerous, ill-conceived, and potentially disfiguring protocol with no foundation in science. Dr. Beck further stated candling demonstrates ignorance regarding the basic laws of physics and blatant disregard for anatomy and physiology. There's no data to suggest that it's effective for any condition. So that's from an Audiology Online article, as well as some notations from our dear friend Doug Beck. So we thought that was kind of funny.
Well, and it is. I mean, when I've had patients ask me about it, if you think about, yeah, basic laws of physics, like there's no way that could work. It's not creating a vacuum. So yeah, no, not a
Yeah,
good idea. And also, if you think about it a little bit harder, there's no way that could work. So
right.
I
Yeah,
can't speak to the therapeutic benefits, but I doubt they outweigh the risks. So,
yeah. Okay, so moving on, we thought of a great topic that people don't necessarily like to talk about, but we still do talk about. And it's one of my favorites, which is misophonia and sound sensitivity. I think that this is kind of left kind of on the back burner. Some people that do work with tinnitus hear about sound sensitivity issues, but misophonia is a really interesting sound sensitivity issue. And it typically is around movements of the mouth, sniffling, smacking their lips while they're eating, and, I would say the onset of noticing that you have misophonia, which is a type of sound sensitivity, really comes out when I would say around elementary to middle school, through high school. Like I usually work with teenagers and kids that have noticed this, and it first comes about where they are very irritated with sitting around the table with their parents, and eating at the same table. And so what happens is they tend to retreat from the table because they just it's that noise of either chewing something, smacking their lips, slurping, or sniffling. Okay, literally gives them a physiological response to that sound. And so they literally have to leave. And that could be like maybe the raising up of the hairs, on the back of their neck, or they just are really uncomfortable, like it hurts their ears. And so they literally have to retreat and not have meals with their family. And typically, what I try to do is I do some music therapy to try to get people to get back to having some control over their environments, as well as I work with these typical, like I would say, teenagers or so, to really get them back to sitting down at the table again. We try to find out what it is that noise, and can I get them back to the table? Maybe not facing them, maybe with AirPods in and they're playing some low level music, whatever it is, but really to get them back to that table with their family. And that's typically what we see. So misophonia is really kind of an interesting topic. Not a lot of people know about it, nor is it talked about. And so we thought we'd bring it on our show of things that we don't necessarily talk about a lot, but we still do, or we like to still talk about them. And we
mhm.
can always have another show a little bit more about tinnitus, sound sensitivity, and even misophonia, but we thought we would bring that one in as well.
And I remember sitting in on a consult with you, And this was years back, but both the mom and the son were having the same issue. And so the kid would go to his room, she would go to the living room. So dad's sitting alone at the table by himself. So the whole family's, mealtime was disrupted. And so I thought that was interesting because, not only was the mom dealing with it, but then the kid was dealing with it. So the solution was just that we don't eat in the same room, which is, not cool. So
Yeah. So these are things that hopefully we're getting people to talk about, even though it might be uncomfortable, or you're like, ooh, I'm a little embarrassed to talk about this, but like to still talk about it because there are solutions to help you
right.
better with your ears. Okay. So the next one's going to be kind of fun. It is cauliflower
Yes.
ear, or what we call perichondrial hematoma. And actually, Dr. Galloway has a special interest in this one. So I'm going to let her cover this one.
So my husband wrestled in high school, and he, coached wrestling for a middle school locally for a while. And so anyway, he knows all about the wrestling world. And cauliflower ear is a very strange status symbol in the wrestling world. And Dr. Phillips actually verified that. She found a New York Times article that there we go. So cauliflower ear is perichondrial hematoma. And I actually learned, I'm going to read here so I can inform you. It's an acquired deformity of the outer ear. It's when the cartilage of the ear is injured by trauma or inflammation, the blood supply from the skin is disrupted and then forms a large pocket of blood called the hematoma. So when it isn't drained properly, it can become infected. If the initial injury is ignored, the cartilage in the outer ear may overgrow, resulting in a bulbous deformity. So I didn't really know what made it look like that or why, but that it's just a hematoma, but because of the cartilage and the way that the pinna is, it ends up leaving it looking, kind of deformed from that. So let's see. We also have some more facts about it. You might be able to reverse the appearance with corrective surgery known as otoplasty, but probably wouldn't want to do that if you're a wrestler because, people are going to think you're more important if you have symbol. And then how long does cauliflower ear take to harden? So it's usually 5 to 10 days for a fluid-filled ear to harden and up to 8 weeks for the perichondrium to permanently attach to the cartilage surface. So if you're a parent and your kid wrestles or whatever and they get this situation, it can be drained, and that can really help the condition so that it's not going to overgrow and create that sort of bulbous look. But it happens a lot with wrestlers just because of they've got like headgear on and just blows to the head, things like that. But that's our little tidbit on cauliflower ear.
I love that because I always notice it too. And I'm like, oh, cauliflower ear must have been a wrestler, so, but I had no idea on how high the rank was in just kind of having a status symbol. Yeah, it was a USA Today, I think, article that said that wrestlers, I mean, that's like their status symbol. So I thought that was kind of interesting.
Yeah. Well, and like MMA fighters and stuff too. So yeah, it's like a badge of honor, I guess.
Right. Badge of honor. That's what it is. All right. Okay. So moving on. So again, we decided not to put up pictures of some of these. We have two more, these last two, because again, we just don't want to, we just want to make sure that you still tune in and you don't have to not watch, but again, these are some of the things that we don't talk about that we still want to cover related to the ears. But the first one would be odoria. Odoria basically means ear drainage. We talk about this a little bit when we take history, when you come in. The causes are usually from like swimmer's ear, maybe if you've got what we call exostoses, that there is like the hardening of a bone that comes out into the ear canal so that it's hard to drain the water after you've gotten into the water, even in a swimming pool. But typically, sometimes if there's water that stays in your ear and you're having a hard time draining it after you were swimming for a while, it can lead to an ear infection, then maybe even a perforation of your eardrum or the tympanic membrane. And that can also lead to drainage as well. So the treatment is usually oral antibiotics or ear drops to help get rid of that infection so that it reduces any duration of that drainage and any severity, like to actually create more of an infection by getting, to the middle ear section there. So that's odoria, that's ear drainage. So when we ask you, when you come in for history questions, we'll ask you if you've had any ear drainage, maybe if you've woken up at the middle of the night or in the morning and there's drainage on your pillow of a certain color. So we usually try to ask about that. It'll tell us some information whether or not you have that. And then the last one is Pseudomonas. I think it's pronounced aeruginosa. I'm not really too sure, but this is basically a very low grade infection that starts off in the what we call the external auditory canal, or basically your ear canal. And if it's left untreated, this is when it can kind of progress into a more type of external otitis, which is called malignant external otitis. And, the reason why I want to talk about this is because I believe my friend actually had this because she went swimming when she went to like Costa Rica. And then ever since she came back from this trip, her ear canal flares up every so often from time to time, and there's pain, there's some drainage as well. What's interesting about this, when I looked it up, this Pseudomonas, is that it has kind of like they say it's a pearlescent appearance. Okay, and this is weird, and I told Dr. Galloway before we got on here, it has a grape-like, so a sweet odor to it, or a tortilla-like odor, like a corn tortilla. I don't know why. I thought I would just tell you. It's not like if my friend was having symptoms, I would probably go up to her ear and smell it. I think that's kind of gross and a little weird. But just to let you know,
Yeah.
that's what they're reporting, is that it smells like either grapes or a corn tortilla, which
Well, and one of the things that said grape-like or tortilla-like, and I'm like, I don't think grapes and tortillas
close.
smell the same, honestly.
Right, I know.
But if you're an audiologist and you have gotten close to anybody that has kind of a nasty ear infection, like you can smell it, and it has a very distinct smell too. So I know that's gross, but it's true. That means there's something wrong. So
yeah, so if you smell a grape-like odor or a corn tortilla-like odor, they might have Pseudomonas, but you probably would also see something when you look into the ear canal if it has gotten into a bacterial infection and it's now otitis externa as well. So again, we're talking about this because even though we don't want to talk about it, because just to be aware of when you go swimming when you're on vacation, right? It could be the bacteria could be in the water of some sort, especially in the river, in places that you have no idea just jumping into the water. Pools are a little safer, right? Because they've got the chlorinated water to protect from all of that. But it's mostly like if you were to jump into a river or a lake or something like that, there might be bacteria that gets into the ear that stays in there and then ends up giving you the Pseudomonas, right? So we just want to make sure that you understand what it's all about. Some of the symptoms is that there's that itching, that pain, sometimes the discharge from the ear, and then serious infection, just so that you know, can also cause high fevers and chills, and just exhaustion or being tired. But then also, if it's really severe, you could start to notice some central nervous system effects, which that makes me really nervous, but we have to talk about it, right? And we have to let you guys know about it too. So, if you remember that your history was you went someplace and you jumped into the water, and you got this bacterial infection, keep an eye on that and watch your symptoms, because we want to make sure that it doesn't get into more of those severe types of symptoms. Usually it lasts about 7 to 10 days. Some people have recurring symptoms over 3 months. I think my friend had it over like a year, if that's what she had. But I almost feel like this is what she did have, because it was recurring and it would come up every few months. And it was the same thing, it was that pain, the itchiness, the discharge. It didn't affect her hearing at all. Sometimes it can affect your hearing if it's left untreated. And typically, the treatment is you actually have to be on an oral like antibiotic, like ciprofloxacin or something like that, to actually help. But yeah, so this was something that I thought I'd bring up because, I think that, again, people don't talk about it, but we need to talk about it so that you know about it, right? Just the awareness. So, yeah.
Well, and I guess we should have added this on. I didn't think about it, but fungal infections too are real. Like you can see mold growing in somebody's ear. It's insanity. I didn't know. I mean, until you've seen it and you're like, that looks like the mold that grows on bread. And it's in their ear and it's under huge magnification with your otoscope. But yeah, there's all kinds of stuff that can happen just based on, environment. And I'm just thinking, traveling, it might be more humid, less humid than what you're used to, swimming in like foreign waters that, have bacteria that you haven't been around. There's all kinds of different things. So, and especially if it's left untreated, then it can sort of spiral into, something worse that might be harder to get rid of.
Yeah. So, as you can tell, like there are things that we talked about today that we as audiologists don't necessarily like to talk about, but we do need to talk about. Maybe there's things that you've thought about. They're like, I kind of want to ask, but I'm a little embarrassed. Send us a direct message and let us know. We might do another like session 2 of things we don't like to talk about, but we
Mhm.
still do. Or if you're audiologist that you've experienced certain things, come on the show with us. We'll bring you back, we'll bring you in with us, and you can talk about some of the things that have come by your clinic or your eyes, and allowing just people to learn about different things. I've learned about things that we had to look up for just for today,
Mhm.
to dive a little bit deeper into some of the things that we see and some of the things that
Mhm.
we've experienced. So hopefully you guys enjoyed this. If you've learned something, share it out. If you've learned something that you might want to pass on to somebody as well, grab the link from YouTube if they're not on Facebook, because it's sitting there. And hopefully you guys enjoyed things we don't like to talk about, but we still do.
Yes, and you're welcome as an audiologist to Google otoscopic images of this stuff, because if you've been an audiologist for long, you have looked in an ear and gone, okay, I don't even know how to describe that. Like, it's not normal, but I don't exactly know what to describe. Like, seeing that powdery substance on the eardrum from candling, I probably would have, thought it's, some sort of scarring on the eardrum or something like that. But so, yeah, it's the more you know. And
Yeah.
especially like fungal infections, stuff like that, it looks very unique, but you
Mhm.
wouldn't know unless you'd seen it before or seen a picture
Yeah.
of it. So,
I feel like that's leading us into another episode of like, what's this when I look into somebody's ear? And then we'll
there
have different things, but we'll put a warning on. So the mountain people, Mountain Standard Time people that are having lunch watching us, won't get grossed out but I think that would be kind of fun too, is to put up a picture of the ear,
Mhm.
what we see in an ear canal, and then talk about what it is, what's going on in that ear canal. So
Yeah,
we
I
might do that.
know in grad school we had a book that was like otoscopy. It was a picture of otoscopy of like every kind of, ear situation that you could have. And some of it, it's like, I mean, you're totally disoriented. It's like unidentifiable. All your landmarks are gone. And so you're like, I don't even know. It's hard to know what you're looking at sometimes.
Yeah, exactly. Awesome. All right. Well, we will be back next week with a whole new episode of All Things Odd. Thank you guys for tuning in. Share this out if you thought it was interesting, or send us a message if you want us to cover something that we haven't talked about yet. And with that, we will be here next week. So we'll see you then.